Hello and welcome. Today I want to share with you some valuable information about the breakthroughs in weight loss medicine with GLP-1 hormones like semaglutide and tirzepatides. These treatments have shown great promise, but they can come with some side effects. The good news is there are effective and safe ways to manage these side effects. Imagine continuing your treatment without any discomfort. That would be amazing, right? So stay tuned as I share the details of this new solution with you today. I'm Dr. Gill, and on this show, I help busy professionals utilize the latest medical breakthroughs in anti-aging medicine. So if you want to lose weight, improve your health, and boost your sexual life, make sure to click follow or subscribe so you never miss an episode. Now, semaglutide and tirzepatide are two of the most exciting and effective treatments for weight management available today. They work by curbing your appetite, suppressing cravings, and promoting a feeling of fullness and satisfaction. These treatments have gained popularity, especially among Hollywood's elites, due to their remarkable weight loss effects. When combined with a healthy lifestyle, they can help you achieve an average weight loss of 15 to 20%. However, some patients have concerns about the side effects, so let me clear the air and provide you with some pointers to minimize these side effects. How can you manage nausea? Nausea is the most common side effect of GLP-1 hormone therapy. It's usually mild and indicates that the treatment is working effectively. However, it can still be uncomfortable for some individuals. And here are some strategies to alleviate and minimize nausea. First and foremost, stay hydrated. Drinking water, electrolyte water, clear soups and broth can help soothe the stomach. Choose light and easily digestible foods like sugar-free pudding, jello, applesauce, or boiled eggs to settle your stomach and provide relief. Consume smaller meals. Eating smaller portions help food move through the gut more easily and is generally well tolerated. Eat slowly. Chewing and eating slowly can prevent overeating and reduce the likelihood of nausea. Consider natural remedies. Ginger, peppermint, cinnamon, and vitamin B6 or vitamin B12 have shown to help alleviate nausea. Try to explore over-the-counter options like Nausea Sweets by Pink Stork and similar other brands. They are designed to alleviate nausea and can be worth considering. Now, while these tips can help minimize nausea, it's important to monitor the severity and persistence of your symptoms. If nausea becomes more severe and leads to vomiting, it is crucial to contact your doctor urgently. Now, what about constipation? GLP-1 treatment can cause constipation as it slows down the gastric emptying time. The decreased appetite associated with the treatment can also contribute to the reduced fluid intake, worsening constipation. Fortunately, there are steps you can take to alleviate discomfort. Prioritize hydration. Again, staying well hydrated throughout the day can help soften the stool and facilitate smoother bowel movements. Aim for about 2 to 3 liters of fluids per day, including water, clear soups, herbal teas, fruit juices, and green smoothies without added sugars. Increase your fiber intake. Incorporate foods like Brussels sprouts, apples, figs, beans, lentils, berries, avocados, eggplant, and chia and flax seeds into your diet. Aim for about 25 to 30 grams of fiber daily. Stay active. Engage in physical activity, even light exercise like walking. It would promote movement in your intestine. Remember, your gut is a muscle and it needs to move. If you simply can't go and you want to try a laxative, start with the osmotic type such as the over-the-counter Miralax. The osmotic laxatives are reasonably safe. If constipation persists though or becomes severe, then it is crucial to reach out to your prescribing healthcare doctor. Okay? Now, what can you do for acid reflux? Acid reflux is a side effect of semaglutide and tirzepatide. It can be managed by adopting these helpful tips. Number 1, eat slowly and take your time. This will reduce the likelihood of acid reflux and aid in digestion. Number 2, avoid trigger foods such as mint, fatty foods, spicy foods, tomatoes, onions, garlic, coffee, chocolate, and alcohol. So make sure you know your trigger foods because prevention is good. Number 3, limit carbonated beverages and opt for flat water instead of sparkling water. This would prevent burping and acid pushing into the esophagus. Number 4, allow a couple of hours for digestion before engaging in intense exercise after a meal. Number 5, stay upright for 2 to 3 hours after meals to keep acid reflux at bay. Next, avoid lying down immediately after eating, especially at night. Number 6, sleep on an incline, elevating your head by about 6 to 8 inches to prevent acid reflux during the night. Quit smoking if you smoke, and maintain a healthy weight to alleviate pressure on the stomach and reduce the chances of acid reflux. In other words, you have to lose some weight. By incorporating these practices into your routine, you can effectively manage and reduce the discomfort associated with acid reflux. Now, what can you do for gas like belching and flatulence? Gas, belching, and flatulence can happen due to the GLP-1 hormone treatment, causing occasional discomfort and pain. To manage these symptoms, it's important to identify foods that contribute to gas and bloating. Complex carbohydrates, starches, and fatty foods can be very difficult to digest, as can foods rich in indigestible fiber like beans, broccoli, and cauliflower. Avoiding these trigger foods is crucial. Prevention is the best approach. But if you experience discomfort, over-the-counter options like Gas X or Beano can provide relief. Now, what about if you experience weakness, tiredness, fatigue, or dizziness? Well, these symptoms can occur during GLP-1 hormone treatment due to various factors, but they can be effectively managed. One reason for these symptoms is the metabolic shift when transitioning from a high-sugar diet to a low-sugar or low-carbohydrate diet. This shift can affect energy levels, causing weakness and fatigue. However, these symptoms are temporary and should improve as your body adapts to using body fat for energy. Low blood sugar or hypoglycemia is also important to consider as side effect of GLP-1 hormone therapy. To prevent low blood sugar, avoid 1 meal a day fasting program while on semaglutide and tirzepatide. Remember that these hormones were originally developed for diabetics. So maintain a balance and a regular eating schedule and keep protein shakes, protein bars, or nuts handy to maintain your energy levels and stabilize your blood sugar. Inadequate fluid intake and dehydration can also contribute to these symptoms. So again, it's important to stay properly hydrated throughout the day. In summary, semaglutide and tirzepatide provide effective weight loss results by curbing your appetite, suppressing your cravings, and promoting a feeling of fullness and satisfaction. On average, they result in a weight loss of 15 to 20%. While some side effects may occur, there are wise ways to manage them. It is crucial to titrate your dose slowly and maintain regular communication with your healthcare provider. By staying in close contact with your doctor and addressing any concerns promptly, you can optimize your experience with GLP-1 hormone treatment. So, if you are ready to lose weight, feel great, and explore the benefits of semaglutide and tirzepatide, we're here to assist you every step of the way. Visit our website to schedule an appointment. Thank you for listening. I'm Dr. Gill, and I'm here to help you thrive and overcome your health obstacles.